Welcome to Clinical Cantonese online lesson 臨床廣府話 provided by Family Care Physio Clinic. I'm a collaborating teacher banned from Hong Kong, and I'm also a registered physiotherapist. In today's session, we are covering the first topic, basic greetings, patient report, and medical history taking. I will teach you some phrases that are the ones that are used every single day in clinic, and they work extremely well with Cantonese-speaking patients in Singapore and Hong Kong as well. Let's set the scene first. A patient has just walked into your consultation room. You want to greet them warmly while building instant rapport and smoothly move into their medical history. These phrases will help you do exactly the same in natural, respectful Cantonese. First, the four essential greetings that create a friendly first impression. Good morning, you can say 早晨,早晨. This is the perfect bright morning greeting. In Singapore clinics, many patients come early, so starting with 早晨 instantly make them feel welcomed and respected. While the second one, good afternoon, 午安,午安. It is short and polite, and you can use this from noon onwards, and patients often smile when you greet them properly in their own language. And the third one, please sit, you can say 請坐. 請 means please, and 坐 means sit. 請坐. While the fourth one is quite difficult. If you want to say, how can I help you today? You can say, 今日有咩幫到你? 今日 means today. 有咩 means anything. And 幫到你 means help you. So in full form, 今日有咩幫到你? I think this is your all-purpose opening question. It is warm, open-ended, and also invites the patient to tell you the story in their own words. Now we move into the two key assessment questions. If you want to ask where do you feel uncomfortable, you can say 邊度唔舒服. 邊度, it means where, and it asks about the location. While 唔舒服, it means uncomfortable. So 邊度唔舒服? Well, the next one, if you want to ask about how the patient injured, you can say 點樣整親? 點樣 means how, and 整親 means injured. So you can say 點樣整親? And I think it is important to understand their mechanism of injury, and you can ask them in this wording. So after building report, we may move into the important medical history part. And here are the four key terms that I ask about the patient every day. So the first one, drug allergy, you can ask 藥物敏感. 藥物 means drug or medication, while 敏感 means allergies or sensitivity. 藥物敏感. And then the next one, if you want to ask about chronic illnesses, you can ask 長期病患. 長期 means chronic or long term, while 病患 means illnesses or conditions. 長期病患. And then the next, if you want to about the injury, you can also say 受傷. 受傷. And then the fourth one, if you want to ask about the exercise habit, you can say 運動習慣. 運動 means exercise. 習慣 means habit. So 運動習慣. I always ask this to my patients because it tells me their baseline fitness level. And I also design the physical exercise based on their regular exercise habit. Now let's combine everything into three ready-to-use full questions. It is a very useful pattern in Cantonese. For example, if you want to ask, do you have any drug allergies? You can say 有冇藥物敏感? 藥物敏感 is the terms that we have learned previously about the drug allergies. And then if you add 有冇 in the front, it becomes a question to the patient. So 有冇藥物敏感? And then the same pattern can be used in other questions. For example, if you ask, do you have any chronic illnesses? You can say 有冇長期病患? 有冇長期病患? And lastly, if you want to know, have the patient seen any other doctors, you can say 有冇睇過其他醫生?有冇 you have learned it is about asking the question have you, and then 睇過 means seen, 其他醫生 means other doctors. So in the full form, 有冇睇過其他醫生? So it helps you to understand if the patient have any previous medical checkup or any medical treatments given. I think in Singapore or in Hong Kong, patient often mix English and Cantonese together. So if they reply in English, so just continue naturally. And I think the patient still appreciate you trying in Cantonese. Lastly, this is the complete topic of today's session of clinical Cantonese. I think these phrases will immediately make your Cantonese speaking patients in Singapore or anywhere feel more comfortable and respected. If you enjoyed this session, please like and subscribe us. And then in next topic, we'll cover the pain assessment and body parts in Cantonese. You can also comment below which kind of phrases are you most excited to use tomorrow in your clinic, or you can also mention what kind of phrases you want to learn in Cantonese. So thank you very much for watching. See you next time. Bye bye.